Thank you, Dylan. Well, we are talking kids with Dr. Caitlynn this morning with Lexington pediatrician Dr. Caitlynn Iddingson. Great topic this morning, Dr. Caitlynn. We're trying to figure out how to tell the difference between our kiddos with an ear infection or is it just teething?
Yeah.
Question mark.
Yeah, and so, once they get old enough to tell you, like, my ear hurts, which is usually around 2, 2.5, 3 years old, that is helpful, clearly.
Yes.
Parents rejoice. They're like, oh, thank you for telling me.
You're communicating.
You're communicating, but, when they're younger, especially kind of in that kind of 6-month to year range where they aren't very verbal, a lot of parents are like, I don't know, they've just been off, they're not sleeping well, they've had a fever, like, is it their ear, is it their teeth? They seem to be drooling. And so the thing about teeth and ears is they do share the same big facial nerve that kind of runs through the ear and then down to the jawline.
Okay.
And so sometimes when babies are teething, they might kind of rub their ear, and that's always kind of like parents come in and say, oh, well, they've been rubbing their ear, I think they might have an ear infection.
Right.
Or vice versa, sometimes when an ear hurts, babies might kind of chew on their hands more because it's not really localized, right? It's hard for them to figure out where's that pain coming from. So, the things that we tend to say, so teething should not cause a high fever, right? So if your kid, it can cause like 99, right around 100, but if it's above 101, that's probably a viral process that can lead to a secondary ear infection, right?
Gotcha.
So if you're having high fevers, that can be one sign
Big
that,
clue right there.
This could be ears, right? Sleep disturbances are kind of common with both because teething is inflammatory, so it can cause babies to wake up. But what we see is when you lay flat with ears, that fluid can shift, right? And so if there's a lot of pressure, babies don't want to lay flat, whether it's for napping, whether it's for just laying down to change a diaper. So if they lay down and they're kind of rubbing at those ears, that can be a sign that this is more an ear infection, right? And then the other thing is that usually with the ear infection, there's going to be a preceding kind of snotty nose, whether it's allergies or upper respiratory infection, because you have to have that fluid for the bacteria to kind of jump in and have a pool party and cause an infection, right? And so if your kid's not really snotty, I say, well, have they had a cold? Have they been congested? And they're like, no, not really. Then it's much less likely that there is that fluid there in order to build up the infection. So that could be more in the realm of teething.
Bringing back a lot of memories here of that debate in the house. Is this, during this time, is this when the conversation leads to talking about tubes?
Yeah.
For our kids.
And we've had a lot of kids getting tubes this year. We've had, 19-week respiratory season at this point, which is the longest since pre-COVID. So yeah, and we can maybe talk about that another day. Like when do you go that route? When do you need to go see the ear, nose, and throat doctor and talk about getting those tubes in? Yeah. Another
great topic for another day. But good clues there, especially that temperature. Good for parents to remember that. Dr. Caitlynn, good to see you.
Absolutely.
Thank you. Back after this.